Well, we have waited decades for a vaccine to tackle one of the most common and dangerous winter viruses that attacks our most vulnerable. And now it looks like we'll have them in time for cold and flu season.
Yeah, the CDC signed off on 2 different RSV vaccines, one from Pfizer and then GSK. Who should be first in line to get these, though? Senior health correspondent Monica Robbins reports.
It looks like people age 60 and over will have access to 2 new RSV vaccines this fall. A CDC advisory board signed off on allowing 2 groups, those age 60 to 64 with higher risk and those 65 and older, to have access to the vaccines made by Pfizer and GSK. RSV attacks the airways, killing 10,000 seniors a year, but it can have lingering effects for healthier people.
Some people need steroids or inhalers, for a couple months to get over the hump, depending on how severe. But if you're vulnerable, you can end up in a hospital, especially if you have pre-existing lung disease.
RSV can lead to pneumonia, bronchitis, and even a form of asthma. Those with heart disease, lung conditions, or the immunocompromised should talk to their healthcare provider about the vaccine, but so should healthier people.
And RSV seems to be one that causes a lot of post-viral asthma. So even if you're low risk for being hospitalized or severely ill from RSV, everyone's at risk of developing an asthma-type picture long after the virus is gone.
There's no rush to get it. Pfizer and GSK expect to start shipping it to pharmacies in the fall. RSV season typically hits us in winter. Moderna is also working on an mRNA vaccine for those age 60 and over, and we're still waiting for the CDC to approve RSV shots for kids up to age 2 and another for pregnant women to protect their babies. The FDA signed off on those last month.
CDC Director Rochelle Walensky still has to give the final okay before these vaccines can be made public, and then that's expected to happen before she steps down from her position June 30th because she is resigning.
And you know that a lot of people are sitting out there going, okay, is my insurance going to cover this? What do we know about that?
That's the big question. We certainly hope so. The out-of-pocket cost, though, could be $200 or more. When they do become available, though, check with your insurance to see if they're covered. But likely for Medicare, I would assume that they would be, and that's pretty much the population who will get them.
Yeah, we hope so. Monica, thank you.
Sure.
Great information as always.